Hello, everyone. My name is Jessica, and my fellow colleagues and I, Brooke, Denzel, and Lester, are going to be talking to you about the respiratory syncytial virus vaccine today. So, first question, what is RSV? RSV is a common respiratory virus, usually causes mild to cold-like symptoms or flu-like symptoms for some people. Most individuals, healthy, maybe younger individuals, recover in 1 to 2 weeks, but it can become more serious. Adults over the age of 60 have a much higher risk for RSV becoming more serious, and that's what we're going to talk to you guys a little bit more about. Next, we'll talk about the impact on adults over the age of 60 that get RSV. The first is their increased risk of hospitalization can occur. They have an increased risk of developing secondary diseases and infections such as asthma, COPD, or chronic obstructive pulmonary disease, which is a chronic disease of the lungs that can make it harder to breathe when people have this, and CHF, or congestive heart failure. This is when the heart can't pump enough blood and oxygen throughout the body. The CDC posted a statistic that they found with older adults over the age of 60 that contract RSV. Each year, it is estimated that between 60,000 to 160,000 older adults in the United States are hospitalized, and 6,000 to 10,000 die due to the RSV infection. So the study we did our presentation on had compared two different RSV vaccines. One was RSV by GSK, and the other one was Abrezvo by Pfizer. Both clinical trials were done on individuals over the age of 60, so no other age populations or different individuals were in this group. It was only people over the age of 60. Both studies found that the vaccine reduced the RSV symptoms, so that means even if they conducted or they had RSV, their symptoms were significantly lessened because of the vaccine than if somebody had it and didn't receive the vaccine.
The RSV vaccine is applied in a lyophilized state, which is a type of freeze-drying. This is where the antigenic component resides. Antigen meaning the toxic portion that will cause an immune response. From this state, it will then be reconstituted with sterile water before it is administered to the patient. How this works is that the immune system will then have been exposed to the virus in a small amount, therefore allowing it to generate antibodies to better fight a possible infection in the future.
Who should be vaccinated? Based on the clinical trials, it is recommended for adults over the age of 60. Adults are at risk because of their weakening immune system. Underlying conditions, such as chronic heart or lung disease, will increase the effects of RSV. Taking the vaccine can be beneficial by decreasing RSV symptoms. Adults should be aware of the possible side effects after receiving the vaccine. These symptoms can include fatigue, headache, muscle pain, and joint pain.
Vaccine impact on society. We are fortunate enough to have access to the RSV vaccine through a multitude of facilities, providing each recipient with a specified boost to their immune system. With this level of access and utilization, we build towards the shared benefit of herd immunity, which decreases a disease's ability to spread altogether. With ongoing vaccine administration and reporting, there is more data available, thus greater opportunity to improve vaccines.
That being said, let's get back to the RSV vaccine. Remember, which of the following are potential adverse effects of the RSV vaccine? Choose all that apply: fatigue, headache, chills, or joint pain. If you selected letters A, B, and D, you are correct. Using Medscape as the primary source of information, greater than 10% of recipients of the RSV vaccine present with fatigue and headache, while approximately 7.5% present with joint pain after receiving the vaccine. Although there may be side effects after receiving the RSV vaccine, it is important to know that patients ages 60 and older can greatly benefit from receiving it. The immune system weakens with age, and the vaccine can reduce the RSV symptoms once it is contracted. RSV infection can be mild at first, but turn into a more severe secondary infection with more severe symptoms.
The key takeaway for this presentation is that the respiratory syncytial virus, also known as RSV, is a common illness throughout the country. Receiving this vaccine is particularly encouraged in individuals with increased risk of greater adverse effects, primarily those who are 60+ years of age. Nevertheless, we all share the responsibility to learn about practices to keep ourselves and our community safe. Thank you.